Are you wondering if there's a cure for your thyroid or if your thyroid disorder, disease, whatever, can be cured? Maybe you got a new diagnosis of hypothyroidism or some sort of thyroid disorder, and you're wondering, what can I do? Can it be cured? Can it be fixed naturally? Do I have to take medication? You're probably reading, don't take, maybe in some cases, don't take the medication. You'll be on it the rest of your life. So this video I wanted to kind of get into dispelling some of those myths or helping you understand when and where it may be appropriate to look at not taking thyroid medication. So there's four main scenarios where you may not actually need to take thyroid medication. Now, this is kind of a blanket statement, and there's many different scenarios there. So you need to talk with your prescribing doctor and/or talk with somebody that knows what they're doing with regard to thyroid before you just not take it. But so mainly it comes down to your immune system, nutrition, other hormones, and toxins. So if you find that some of these things are off, which I'm going to get into more details as we go along here, there's a chance that you may not need to take thyroid medication. Now, it's going to depend on what your thyroid level is and how it changes over time, what your symptoms are, things like that. Some people have, really labs that are really far off and don't have symptoms. Some people have symptoms and labs are not that far off. So you have to, kind of tread lightly here and don't just say, well, I'm never taking medication, because you may need to. My name is Dr. Terranella, and in our practice, we treat a lot of people with thyroid and other hormone issues. And I wanted to give you a little bit of detailed information on what scenarios are most commonly going to result in not needing to take thyroid medication, even though the labs suggest that you may be underactive or actually hypothyroid. If you have questions about any of the content that is in this video, just ask in the comment section below. Okay, so I want to talk a little bit about some thyroid scenarios here. And the title is, can thyroid disease or thyroid disorders be cured? And in my experience, they can. There's several scenarios where I've found, or themes that I've found, where you can actually reverse or normalize thyroid diseases or disorders. So when I'm saying cured, I mean that you don't have to take thyroid medication mainly. You may have to continue to take a certain supplement or, make some dietary changes or things like that, but no medication. And then the other thing is, I'm mainly referring to hypothyroid, so high TSH situations. And then, so the first scenario is when you have autoimmune hypothyroid. So autoimmune typically is when you have high antibodies. TSH is high, but the autoantibodies like anti-TPO and anti-thyroglobulin would be elevated above the normal ranges. And when you normalize those, a lot of times the need for thyroid hormone also goes down. So I'm not saying if you do get to a point where you're, fixing those autoantibodies, that you don't need to take it anymore, but in some cases you won't. So what are the causes of those autoantibodies to be high to begin with? Anything that would stimulate the immune system excessively or over trigger it for some reason would be something that can cause that. So these are typically food sensitivities or things coming in through the digestive tract that the immune system sees as a foreign invader. So it's going to tag it with an antibody. And every time you eat that food, it's going to get triggered. And sometimes those antibodies have similar structure, similar affinity to the tissues in your thyroid. And as a result, when you eat that food, not only is your that local activity in the digestive tract getting triggered, you're also getting it in your thyroid. So that's going to reduce the amount of thyroid output that you're getting. And so ultimately, the solution would be to tone down whatever that is. Sometimes it's just food, but sometimes it's more related to leaky gut and the whatever's triggering that. So I've talked about that in other videos. You can check those out. I think those might be helpful for anybody trying to um, cure their thyroid or reduce their need for thyroid medication. So that's number one would be autoimmune. Number two would be any kind of nutrient deficiency. So specifically iodine deficiency. Had several cases of people with low iodine that have been their TSH normalized when correcting their iodine levels. I've also had, which is a reason to be careful with taking iodine, is thyroid suppression by taking too much iodine. So be careful that you're not taking too much iodine, and it's probably best to get an actual test done on your iodine. It's usually the serum plasma iodine test to get an idea of kind of whether or not you're low or high on the iodine. Um, Other hormones can also affect your thyroid too. So number three would be like high cortisol can have a suppressive effect or cause your body to push some of your thyroid hormone into storage. So always check cortisol, and you can see this with the reverse T3 test. Um, and then Lastly would be toxicity, so too much chlorine, other toxic metals can impair your thyroid, your ability to produce thyroid hormone. So those are the main things that I think about with, removing those problem areas can normalize your thyroid function. So in normalize and cure your thyroid disorder, hypothyroidism, whatever the scenario might be. So it's important though, keep in mind, don't just do this blindly. You should be testing and making sure, verifying both the actual lab tests and your symptoms are getting better. Sometimes even though you have these issues going on, you correct those, you still have thyroid issues. That's a good indicator that maybe it's time to take the medication. What time frame is going to be different for everyone, but once these things are normalized and you're still having underactive thyroid and a lot of symptoms, it's probably in your best interest to go ahead and take the thyroid hormone. So thanks for watching. Hopefully this information was helpful in helping you determine, whether or not you might fit in a scenario of where your thyroid can be cured, or help you figure out what to do about your current thyroid situation, and troubleshoot or navigate the various ways that you can go about actually curing it. If it was, please click on the like button. This helps me to figure out what type of content most of my viewers are interested in, and then I can produce more information geared towards that. Also, there's a few other topics that I think will be of interest to some people regarding thyroid disorders and thyroid situations. So if you like this type of information, go ahead and subscribe to the channel so you get notified when the next video is posted. Thanks for watching, and we'll see you next time.